We have a whole video on Kaiser versus basically everyone else in the California market. Here we're going to zero down into the Medicare side of things because it really gets unique and specific. We have Kaiser, which is an Advantage plan, and we have a lot of calls these days from people who want to move to Kaiser to another Advantage plan, and we'll go into why that is the case, or who want to move from Kaiser to a Medicare supplement with traditional Medicare. We'll explain what's driving that decision. Either way, they're very different, and we need to understand how to compare them, what we're giving up, what we're getting, and also the process, especially when it comes to the Medicare supplement side, because that's a big jump and it has to be coordinated well to make sure it's smooth for you. So we'll look at all of this. Let's first start with the Advantage side. Why are people looking at moving from a Kaiser Advantage to a different Advantage plan? What's driving that decision? We'll look at how to compare. Let's dive into that now. All right, let's look at the Advantage side first. Why are people looking at Kaiser Advantage plans versus other Advantage plans, especially if they already have Kaiser? That to us is kind of interesting because Kaiser does Advantage plans really well. They generally have 5-star rated plans in a given area where they're strong. So what's going on there? Let's dive into it a little bit. And we typically get 2 different kinds of calls, and that'll help us pinpoint how we compare these options. First of all, with Kaiser, they are all HMO or Advantage plans in terms of the Medicare market. That's the direction, which makes sense. Kaiser's an HMO. So what does an HMO mean? It means that there's going to be more cost constraint from the carrier, in this case Kaiser, on care. So we already have to stay within a given network. That's Kaiser. You have to be within Kaiser if you're with Kaiser. Use their facilities, see their doctors. Rarely can you get out of that network, only if they don't have someone who can do a certain type of procedure. And that's very rare. So we already know we have to stay within the network. Costs are going to be a little more constrained, meaning there's a calculation with every decision. Is it medically effective? Is it financially or cost effective? That cost effective piece is going to figure in more with an Advantage plan. Nothing's for free. We all get that. That's part of the trade-off we make, is that there's a little less flexibility and control with any HMO, including Kaiser. So then why would someone want to investigate leaving Kaiser, going to another Advantage plan, which is also generally an HMO? There are usually 2 types of calls we get on that front. One is, for example, we had someone call us up who wanted access to a surgeon at Keck down in USC. They were the absolute best at a certain type of surgery tied to a certain type of cancer. In fact, this surgeon taught all the other doctors, including the Kaiser doctor equivalent, on how to do these procedures. So this person wanted the best. That's a situation where then we need a different kind of Advantage plan who will contract out with that doctor, with Keck or the medical group that will allow you access to that group, the hospital and the doctors themselves. So in that case, he wanted access to Keck. He wanted to leave Kaiser in order to do this. He happened to be lucky in that it was a time of the year when he could make that change. There's certain windows for Advantage plans when we can jump around, either over Medi kind of throughout the year, or open enrollment or other special enrollment triggers. So that's an example of someone who wanted to make that jump to another Advantage plan that would allow us. And it was a process tracking down which plans we could use that would allow us to see this doctor, get the referral out. It was a zoo. So lean on us for that piece because it can get complicated, and it did, but we figured it out in the end. But again, it wasn't easy. The other kind of call we usually get is someone who had Kaiser, they moved to another area, and Kaiser is either not in that area at all, or they're not as robust as they were in the past area, like it's further away. Okay, you're in the Kaiser footprint, but it's not really accessible like it was in the old neighborhood. In that case, a lot of times those people also look for a different Advantage plan from another carrier, which makes sense because they want the same kind of structure and cost of an Advantage plan, and they're comfortable with the trade-offs like we talked about in the video, but they want access to different medical groups and doctors and hospitals in the new area. And so, or in their given area, they're just not happy. They don't jive. And we'll have calls that way where they move to another area and they just don't really like the feel of the new Kaiser facility for whatever reason, which is interesting to us because you would think that would be pretty uniform, but it isn't. It bounces around from location to location. Some are pretty solid or stellar. So that can figure in where you go to a new area or you're in an area where you just don't like the Kaiser feel. You don't like the decisions you're getting back. Some of that's HMO. Don't forget that. Some of it isn't Kaiser. It's just the HMO model. We may still have some of that and likely have some of that on an Advantage or HMO model with other carriers. It may be a function, though, more of the doctors and hospitals you can see. And again, each carrier is going to have a slightly different take on how much is managed and how much isn't. The star rating should reflect a little bit what the existing members feel about their plan and how easy it is to deal with. So definitely lean on those star ratings. If you are going outside of the Kaiser network, really aim for 4 or higher stars on any plan you're considering, because that tells you a little bit about what kind of pushback and what you're going to deal with for the whole HMO model side of things. Keep in mind, there are also PPO Advantage plans as well that some people gravitate towards because they have a lot more flexibility and control. It's not quite a Medicare supplement, but it's kind of in between the HMO side and a full supplement where you can just go to any Medicare provider anywhere in the United States. Decisions are made between you and your doctor quite a bit more. There's a trade-off with cost, but that's a whole different wing than the PPO Advantage market, which is more flexible than the HMO, but not quite a supplement. So that's the Advantage side of things. Usually the changeover is pretty easy because we have open enrollment at the end of the year. We have special enrollment triggers throughout the year, depending on your situation. Medi-Cal's about to get, Medimedi's about to get super flexible where we can make changes all the time. So reach out to us on your situation. We can run quotes, tell us who you're trying to get access to, because that really drives the decision quite a bit. We'll look at star ratings to make sure it's a Advantage carrier that maybe might be flexible, you might like how they feel, or even the PPOs to see if that's a fit. So that's the Advantage side of things. Let's now turn our attention to Medicare supplements in the Medigap world and people looking to compare Kaiser with that animal product out there in the Medicare market, which is completely different from Advantage plans. All right, now we're comparing apples and oranges. We're going to look at Kaiser Advantage plans. And again, they're all Advantage. They're all HMO. And we've talked about what that really means in terms of how the plan functions and where there's some pushback or some friction with certain members. And then we're going to look at Medicare supplements, Medigap, which is the polar extreme. Those are the two real markets right now in Medicare for people who have Medicare, who want to wrap around the risk of just traditional Medicare Part A and B, which is really that 20%. You don't want that 20% uncovered or taken care of with either Advantage or supplement, because it can go on indefinitely. So a $100,000 bill means $20,000 out of your pocket. There's no reason to take on that risk. So why would someone look at a Kaiser plan versus a Medicare supplement? And we're getting a lot of these calls right now. Part of it is because we're in open enrollment, which is actually a good thing in terms of timing, but let's dive into that a little bit. Usually the calls or emails we get revolve around something like this. My father or I have Kaiser and we don't like the way it's working. We don't like the decisions they're making. We don't like that we have to stay within it, but it's usually more around the decision making in terms of healthcare than it is about the location, because Kaiser has some really solid locations depending on where you're based. Everything's kind of tied in together. It makes it easier. So why would someone want to jump from that to a supplement? It really is that care. What they're finding is they're getting things turned down. They're getting medications that are not denied. They're in a step fashion where you have to do this generic, and sometimes it'll switch for you. capriciously where there's not really a basis for it. Again, Kaiser is the pharmacy, so they negotiate these big contracts for medications, and they can switch one out if it's more price or cost effective versus another medication that might be equally effective but is a little more expensive. The problem is a lot of people get used to that medication and may work well for them, and then they have to shift. With an Advantage plan, you don't have much decision on that move. You have to shift. With a Medicare supplement or a Medigap plan, it's night and day. First, let's talk about networks, because that's a big driver of the decision. With a Medicare supplement, you can go to any provider anywhere in the United States who accepts Medicare. You can refer yourself out. You don't need a primary care doctor. You're not locked into a local region or medical group. If you travel or split time in another state, you can see providers, Medicare providers in that state. It travels with you. So it's much more flexible in terms of the network. And that's half the equation for people who have Kaiser. Now, if they're in Kaiser, they like it, great. They've been in Kaiser their whole life, which is a lot of people who are born in Kaiser, then they may not understand that. However, if you want access to Cedars or UCLA or Sharp-Steele or UCSF or MD Anderson and Houston for cancer, that's a Medicare supplement. There's no way really to get around that. Even the PPO Advantage plans are going to be a little tricky having that kind of flexibility. You're just not going to get there. The Medigap or Medicare supplements, like the G plan, which is by far the most popular, is going to allow you total access across the United States. There is a monthly cost that comes with that, but for some people, they want to have access, especially if something serious comes up. And they want to go to the absolute best for a given situation. They're willing to pay that extra amount of money to do it. The other part that comes up is that control of care we talked about. So there's network, but then there's your control over what decisions are made being between you and a doctor versus you and an insurance carrier. And that's what it comes down to. The insurance carrier is kind of like the accountant who's saying, before we're going to do that surgery, we're going to try these pain medications, then we're going to try physical therapy, then we're going to try this. So there's a step function, and they may decline certain things. They may say, that medication, I'll give you an example. The new SGLT2 inhibitors are fantastic for diabetes, especially if there's a dementia risk. I mean, the research is crazy on those. There's a study on longevity from the UK where they have access to everyone's information medically because it's single payer. And for longevity, it had the most impact of any medication they prescribe. Estradiol was number 2 for women. And then metformin and atorvastatin for cholesterol were almost no effect. But that one medication, the sodium glucose medication, like a Jardiance, and they're about to have generics in 2025, those had a huge impact on longevity. And also there's research on dementia. I bring that up because we're researching it right now for a family member. So this becomes really important because an HMO can say, you know what, Jardiance is expensive. We're not going to do that class of drug, or we're not going to do that medication if there's an equivalent. And they may say, for an equivalent, there are these other medications that do about the same thing if they're looking at diabetes, not if they're looking at dementia risk. Whereas your doctor may say, hey, we really like this class because this can not only really help with the diabetes, but also, we're seeing some cognitive issues. Again, they call it diabetes type 3 diabetes now, right? I mean, they call it dementia type 3 diabetes right now. And so we want access to that. A doctor may say that's going to be a good move for your family member, for you, for your loved one. An HMO can say no. Well, boy, that can make a huge difference. I mean, to me, that's kind of like penny wise and pound foolish because the cost of dementia is going to be through the roof. But that's a question for another discussion we'll have on our healthcare system. However, back to what we're getting at, with a Medicare supplement, and or you would have to have a Part D in conjunction with that for medication, you're going to have more control over decisions that are made in healthcare. There's going to be more dictating what happens, and that's going to be done more with your doctor. That's the big difference. Those are the two things that people come to us with from Kaiser, is that they don't like the HMO model more than they don't like Kaiser, because they don't like the decisions coming out of it, and they don't like that they have to stay within this network. It's not flexible. They can't move around. They can't see a specialist who's really good at something either across the state, across the city, or across the country. And so that's where we see the pushback. And they're willing to pay the extra premium and costs, monthly costs for a G plan, for example, or the N plan, depending on your age. We run the quotes across the major carriers, across the N and G, to see who's priced better, because it can really bounce around. So we can do that for you. There's no cost for assistance, but definitely make sure, because there's a huge spread in costs on the Medicare side. Now, let's talk about the transition from a Kaiser plan to any of these other plans. If you decide that's the right move for you, let's look at that piece, because that can get complicated. We can guide you through it. Let's touch base on that move over first. All right, I'm glad you stayed with us, because this piece gets a little more complicated. We're going to touch base on the general layout, but reach out to us with your specifics, because it can get difficult. Let's talk about the move over from a Kaiser Advantage plan to either another Advantage plan or to a Medicare supplement. Now, if we're going Advantage to Advantage, that's not too bad, because the Advantage plan market generally has rules around when you can move, how you move, and it's pretty easy. We have a simplified way to run quotes for you. You can enroll right through the quote. It's all tied into Medicare. So if and once approved, it would cancel out the Kaiser. You'll be on the new Advantage plan. Let's take open enrollment as an example. If from October 15th through December 7th, we make a change, it will go into effect January 1 from Kaiser to our new plan. Just a heads up, from January to March, if you don't like the change you made within Advantage plans, you can make another change. You can switch back, you can switch to another Advantage plan, or you can disconnect the Advantage plan completely and just have traditional Medicare. That's January through March of every year. And there can be SEPs, or special enrollment triggers, throughout the year. So a loss of coverage involuntarily, if they cancel you, drop you. If you move to an area where that plan is no longer available, that can be a trigger as well. And there are others. So reach out to us. Especially now, we're getting all these storm and fire SEPs throughout the state, different counties, where we can make changes based on that. And the people who have true Medi-Cal, and Medicare, starting in 2025, they can make changes once a month, which is the most flexible. Right now, it's once a quarter for the first 3 quarters, and then the standard open enrollment. So if you have an Advantage plan with Kaiser, there are lots of ways to make changes. You may have to wait a little bit, but reach out to us and we can touch base on your situation, what's available. Now, going from a Kaiser Advantage plan to a Medicare supplement is a little more complicated, because unless we have a special trigger that allows us to cancel or change the Kaiser plan, that will continue out through the end of the year. Again, reach out to us, because there's all kinds of little weird wiggle rooms we can look at to drop and add and change. But let's assume we've been on it for a while. We don't have a special enrollment period. Then we would get out to the end of the year when open enrollment kicks back up, October 15th to December 7th. Here's the tricky part. We want to make sure the Medicare supplement is active and approved for January 1 before canceling the Kaiser plan. And that's where things get tricky. So we recommend submitting the application, and we can help guide you in this whole process. Submitting the Medicare supplement application generally around November, early November, because we want to get an approval back from the carrier for a January 1 effective date before we ever cancel the Kaiser plan or discontinue the plan essentially. We also have to pick a Part D for during that window for a January 1 effective date. So there's a little bit of coordination. The key part is we don't want to cancel any plan until we get approved with the Medicare supplement. Because once you get outside open enrollment periods, Medicare supplements coming from an Advantage plan are generally going to be medically underwritten. We don't have to be in great health. Amazingly, we can get a lot of people approved. It has to be pretty serious generally where we get declined, but they can decline us. And so we do not want to cancel any existing coverage until we have the Medicare supplement approved with a new carrier, in this case for a January 1 effective date, because we'll coordinate the Advantage plan being canceled for January 1 and the Part D for medication, because supplements don't cover medication like Advantage plans generally do. We also want to get that Part D for a January 1. So there's a little bit of coordination. If you reach out to us October, November, generally that's fine. I mean, we can do it into December, but it's getting a little bit close to the wire, especially with open enrollment at such a zoo. Ideally, you do that during November would be perfect. The birthday rule with Medicare supplements is if you're going from one Medicare supplement to another Medicare supplement. Now, some of the carriers will do what they call medical underwriting holidays. We'll see Shield do this every now and then towards the end of the year, where they would even allow an Advantage plan from another carrier to move over to a supplement regardless of health. It's not every year. We can't count on it. For example, this year, they're not doing that. We'll see what they do at the end of next year, or if other carriers have different offers to allow people to jump on a Medicare supplement if they're coming from an Advantage plan, regardless of health. In the meantime, though, reach out to us. Let's go through your situation, figure out what the options are, look and see if Kaiser is the better fit, or if a different Advantage plan is a better fit, or if a Medicare supplement fits your situation and what you're looking to do, both in terms of cost and in terms of flexibility and control. And that's the best way to access all of this information. This is complicated, so reach out to us. We're happy to walk through. We don't push, we don't sell. We will see what sizes up best for who you're looking to get access to and go through the different options on how to compare Advantage plans, how to compare the Medicare supplements, and investigate what works best.